Welcome to India TV. I'm Anshu Singh, and with me we have Dr. CHOWBEY. He's a Padam Shri who has conducted 95,000 surgery, and one of the surgery was of His Holiness Dalai Lama. Sir, welcome.
Thank you.
So, there's lot of doubts and controversies around bariatric surgery. Now, what is bariatric surgery?
Actually, I think before we go to bariatric surgery, there is one point which everybody should be clear, and what is your BMI, body mass index? Because this is, I think, like blood pressure, this is the indication of obesity, overweight, morbid obesity, super obesity. So how you differentiate? It's very important to classify a person. What is his or her BMI? So, and it's very simple, easy to calculate. The weight in kilograms divided by height in square meters. It gives a figure which is known as a BMI. So we consider BMI up to 27.5 as a normal BMI. If it goes from 27.5 to 32.5, it's obesity. And if it becomes more than 32.5, it is known as a morbid obesity. So all the bariatric surgeries are done for morbid obesity. That's very important to understand. And once we see the patient which has BMI is less than 32.5, they are not the candidates for weight loss. The best weight loss can be achieved by changing the dietary pattern and also doing little physical exercise. And also something which is not very commonly known is the sleep pattern. So if you have good sleep pattern, that means maybe about 10:30, 11, if sleeps till morning 7 o'clock or 8 o'clock, this is a right sleep pattern, because it has been seen that if your sleep is not complete, and not only in hours but also in the cycle of night for that particular thing. So unless we have that, there are more ghrelin hormones which are secreted if somebody is awake late night. And the ghrelin hormone, as we know, is a hunger hormone. So once we have more ghrelin, then person will feel more hungry and will eat more, and with more calories going in. Second principle is loss of calories, and that happens by exercises. So this is a balance, and if we are not able to maintain the balanced approach, then a person becomes either morbidly obese or super obese also when it's 40-50 kg more.
So what are the complications? And as you said, one has to take care. There are long-term things that one has to look into. So what are the complications during the surgery? Are there any complications, and post what?
Well, I think the important thing is who is operating, which team is operating. They have the experience, which institution is there, because this is one surgery which needs multiple departmental this thing, and multimodality management is the way we can reduce the complications to less than 0.5%. And if the anesthetists, they are expert for bariatric surgeries, the intensivists are there, the endocrinologists are there, the physiotherapists. So if all these things are there, the complications rates are very, very less. It can be compared with any general surgery. But if it is not done well, this is done in the institution which is not the right institution, not the training, complete training for the whole team. So by and large, the bariatric team is about 30 to 35 medico and non-medico persons. So you can imagine that any institution who is having such a large number of trained physicians, then only the success rate is achieved. And then I think the good quality of staplers, because it's a stapler driven surgery. Many times they make a mistake of going in for cheaper surgeries, and those cheaper surgeries may not have the right type of stapling devices. So it is important that you select the right team, the right institution, and follow the instructions given by them. It is a fantastic surgery, and we classify it as a life-saving surgery.
So patients with other diseases like lifestyle disorders like diabetes, blood pressure. What about these people? Can they also?
No, they are more indicated. They are the more people who are more indicated to get in for that. So, for example, if there is a morbid obesity and diabetes, now these patients, when they are operated, 92% of them, when they lose weight, they become non-diabetic. So, what a blessing! I mean, to become non-diabetic, because diabetes is one of the most sinister disease, which affects the heart, which affects the joints, affects practically all, sleep, diet, etc. we have discussed. So it is important to understand that bariatric surgery will be most effective for diabetic patients, and almost 92% resolution, and they become non-diabetic. Hypertension, joint problems, sleep apnea, snoring, possibility of getting cancers, all those things are reduced by one surgery, that is a bariatric surgery.
So is it cost effective?
It is cost effective after 2 years. So whatever you spend, and it reduces the number of medications, number of investigations, number of complications, gangrene, diabetic gangrene, and cardiac issues with diabetes. So, it all depends. And after 2 years, every year the person is gaining. At the long term, we can avoid something like dialysis, we can avoid kidney transplants, we can avoid injuries produced by the diabetic pathology. So, it's a win-win situation all the way.
And what is that one thing that youngsters should take care of?
Well, I think it's easier said than done, is their proper sleep. And because they know that they have to control the calories, they know that they have to do some exercise, but many times, and majority, including our medical fraternity, doesn't know that sleep pattern is also one of the very crucial. So it's a tripod. If you want to reduce your weight or prevent the obesity, then you have to look after the diet, you have to look after the little bit of physical activity, and of course the third this aspect is the proper diet. So if you do that, we can always avoid the operative options.
Thank you so much, sir, for giving us your time. It was a pleasure talking.
Thank you so much. Thank you.